The rights group Amnesty International has decried a lack of healthcare and support for mental health disability people living in refugee camps. The rights group says that the COVID-19 pandemic has exposed and exacerbated the long-standing neglect of mental health services for refugees and migrants. Amnesty International is calling on all governments to remove barriers that prevent refugees and migrants from accessing mental health services and support. For more on this story, we're now joined via Zoom by Amnesty International's Economic, Social and Cultural Rights Advisor, Iain Byrne, and he joins us from London. Thanks very much indeed for joining us, Mr. Byrne. Welcome to the programme.
Thanks, Peter.
It's quite sad to hear this story, but I guess when refugees travel and make their way to what they perceive to be a place of safety, they are all categorized and painted with one brush, refugee, and no care is taken that each person is an individual with individual needs.
Well, that's right. And the reason that we put out this public statement today, 24 hours before World Mental Health Day, is that, everybody needs the best possible access to mental health care and treatment. And we know that, don't we, even more so during these times. And I know South Africa well. I've done research there, and I know that how many people in the country, as in here in the UK, are really struggling with mental health issues during the pandemic. But imagine if you are a person on the move, if you're a refugee, even an economic migrant, people that are coming through, often fleeing war, conflict, poverty, traumatized. You have particular mental health needs that are not being met at this time. And often they are the subject, sadly, of repressive government actions and policies, which makes their situation even worse. So they're in a sort of vicious cycle, if you like. Often they're subject to human rights violations, then they don't get the care and the treatment that they need to address them.
Is this ignorance or neglect on the part of authorities that these refugees that need these mental health services are just not getting them?
Well, I think there's an overall neglect on mental health services. I mean, what was quite interesting when we started to look into this was how little is actually spent on mental health services. So, for example, in low-income countries, it's the equivalent of 2 cents per person per year. So if you think about that, 2 cents per person per year. And even in the wealthiest countries, say in Europe, you're looking at about $27 per person per year. Now, obviously, some people get a lot more care and treatment, but if you average that out, and compared to the vast need, we know that mental health issues are vastly underreported. And then you've got people who are asylum seekers, migrants, often undocumented migrants, people that are going under the radar, who have particular needs. I mean, we know that there's high levels of post-traumatic stress disorder amongst people on the move, and they're just not being helped. They're not being given assistance. So it's a really double bind that these people find themselves in.
You talked about information. Data is another thing that's lacking, isn't it? And is that on purpose? Because with data, one is able to make better plans.
Well, this is a key aspect, and what I've found looking into economic and social rights now for 20-odd years is the lack of data that's available. And it goes actually into some of the most developed countries as well. And as you said, if you don't have the data to hand, if you don't have disaggregated data, say various groups, or by gender, by race, age, but also nationality, you can't then develop the plans. As you said, you can't develop a strategy. So you're kind of working in a vacuum. And it is actually a fundamental human rights obligation of states like South Africa that have signed up to these treaties. It's not just us saying this. They've accepted these binding obligations to be able to monitor and analyze data. So you would expect that with COVID. You need data to be able to then do the modeling and then to be able to make informed decisions, at the same time.
Yeah.
So you've got to have data.
And then I think you touched on this a bit earlier on, but some of these host countries also are prone to abusive policies, and that makes the situation for the refugees even worse.
Yeah, I mean, we released a report actually a week ago today showing how Ethiopian migrants, but not just Ethiopia, but migrants from several countries in Africa, are being held in appalling conditions in Saudi Arabia. It's a really shocking piece of work that we produced, speaking directly to people in those detention cells, vast overcrowding, insanitary conditions, pregnant women not getting access to healthcare, a whole litany, really, of human rights abuses going on. And not surprisingly, people that we spoke to are really suffering with their mental health. But of course, they're not even getting basic primary health care. Actually, some of the people who've been shot, they're not being given primary health care. So their mental health care needs are obviously not being addressed at all. So there you've got a country that is really treating people in very deplorable way, and then obviously not providing the services and the care and the treatment to be able to deal and cope with what they've been going through.
And this is happening not just in developing nation, low, middle-income countries, but even in the first world. You know, if you think about the Americans separating families.
Well, we've just seen that, haven't we? In the last 24 hours, sort of shocking evidence has been coming out of the States, as you said. But we've known this for a long time, in a way. As you said, the policies have been going on. The way that refugees are being treated and held in Europe, in refugee camps there, severe overcrowding, the failure of states to really share out their responsibilities, lack of adequate water, sanitation, all the things that, those of us who are privileged enough can take for granted to lead a dignified life. These people are not having in some of the wealthiest countries in the world. So you're quite right, Peter. It is not, even though the global south actually has by far the vast majority of refugees, internally displaced people, in the global north, where we don't have so many, we are really failing them as well.
All right, talk to me about COVID-19, because, a refugee leaves a country, is already under enormous mental, emotional strain. They arrive at these refugee camps and places. That adds another layer of stress and difficulty to a problem that already had. And then COVID-19.
Yeah, and then COVID-19, as you said. Look, COVID-19 has been hitting us in so many ways. I know you've had it really tough in South Africa, particularly. Huge number of cases, huge number of people that have tragically died. I've been looking into the education system there, the impact it's had on the kids. But as you said, imagine if you're a refugee, often they are being put into mass quarantine, and there may be good public health reasons for that, but often they're not even getting basic assistance with food, with the medical assistance that we talked about. And that is causing them, severe anxiety for people who already are suffering. They're not allowed out of these camps. They're often not able to work, earn a livelihood. And at the same time, the kind of international assistance that they should be getting is often not there at the same time. So I think, working in human rights, you have to try and put yourselves in the shoes of other people and think about, what they're going through. And, I know that COVID has shone a light on so many issues in our societies that haven't been addressed. And again, international aid, which is vital, obviously, for poorer countries to be able to provide these services, only 1% of international aid is actually on mental health services. So, that very small budget is being stretched so much. And we feel at Amnesty, we haven't done enough on mental health over the years. And this is partly why we want to ramp up this work and why we wanted to go public today, just to shine a light on this particularly vulnerable group when we think about world mental health.